Good evening, guys. I have a discussion for you. Give me a few minutes to set up for the show, and I'll be right with you. Okay, tonight we are talking about joint replacement. Joint replacement for people. Okay, so that is tonight's discussion, joint replacement. But the title is All in Stride, a few age limitations for joint replacement. Okay, the headline captures the central argument of the article. Joint replacement is no longer viewed as a procedure reserved for a narrow age group. Instead, modern surgical techniques, improved implant durability, and better rehabilitation strategies mean that people across nearly the entire lifespan can be candidates when their pain and functional limitations justify it. The phrase all in stride also hints at something deeper. Joint replacement isn't just about fixing worn out knees or hips, it's about restoring movement, independence, and quality of life, regardless of age. What the surrounding page content reveals. One, joint replacement is extremely common. The article notes that over 1 million hip and knee replacements are performed annually in the United States. These surgeries have become routine, predictable, and highly successful. Two, age is not a barrier. Outcomes are strong across the spectrum. Surgeons interviewed described performing hip replacements on patients as young as 12 and as old as 102. The consistent message, chronological age is far less important than overall health, functional goals, and readiness for rehab. What matters more than age? Doctors look for exhausted, non-surgical options, PT, braces, injections, and anti-inflammatories, imaging that matches symptoms, pain that is lifestyle altering, a patient's ability to participate in post-operative therapy, a support system at home. This is especially important for older adults who may need more help at home but often experience greater improvements in pain and quality of life than younger patients because their expectations are more realistic. Younger patients face a different challenge. Implants typically last 15 to 25 years. So younger, more active people may eventually need revision surgery. That's the main reason surgeons hesitate, not because of age itself, but because of the likelihood of future wear. Recovery is a partnership. The article emphasizes that successful outcomes depend on physical therapy, home modifications, mental readiness, clear expectations about what the new joint can and cannot do. The deeper message behind the headline. The article reframes joint replacement as a quality of life decision, not an age based one. It encourages patients and clinicians to think less about the number of birthdays someone has had and more about how much pain they're living with, whether conservative treatments have failed, what activities they want to return to, whether surgery can realistically help them reach those goals. In other words, age shouldn't be the gatekeeper. Function, health, and goals should be. A brief quote that captures the spirit of the article. A lot of research and studies have shown that no matter what the age ranges, people end up doing great. Okay, guys. This is second half of E presentation. And the title for this is All in Stride, a Few Age Limitations for Joint Replacement. Signals a major shift in how orthopedic medicine thinks about hip and knee replacement, where these surgeries were once seen as the dominant for older adults, often a last resort after years of pain, Modern practice has moved toward a far more individualized, function focused approach. The headline captures this evolution. Age is no longer the gatekeeper. What matters now is how much pain someone is living with, how limited they feel, and whether surgery can restore the life they want to lead. This framing mirrors the broader trend described on the page. Younger adults are increasingly choosing joint replacement not because they are aging primarily, but because they refuse to let chronic pain delegate their mobility, identity, or lifestyle. Key insights drawn from the surrounding page content. A demographic shift. Younger adults are reshaping joint replacement trends. The page highlights a shrinking projection. By 2030, adults under 65 will make up more than half of all hip replacements and over 60% of knee replacements. This is a dramatic departure from the era when joint replacement was synonymous with advanced age. Gen X, millennials, people in their 40s, 50s, and early 60s are increasingly unwilling to wait decades for relief. They want to hike, run, garden, travel, and parent or grandparents actively now, not someday. Why younger patients are choosing surgery. The article attributes this shift to several advances. Minimally invasive surgical techniques that reduce trauma to surrounding tissues, shorter hospital stays, and faster rehabilitation timelines, improved implant materials that last longer and perform better. A cultural shift toward prioritizing quality of life rather than enduring chronic pain. Younger adults often say they don't want to spend their prime years sidelined by joint pain. Surgery becomes a proactive choice to preserve identity, uh, independence, and joy. Evaluation is about health and function, not age. The page outlines what an orthopedic evaluation looks like, and it's clear that age is only one small piece of the puzzle surgeons focus on. Medical history: arthritis, osteoporosis, diabetes, obesity, hypertension. Physical exam: swelling, reflexes, gait, range of motion, ability to climb stairs or bend. Diagnostic imaging: x-rays to assess alignment, deterioration, cysts, deformities. Response to conservative treatment: PT, medications, injections, heat cold therapy. This reinforces the headline's message. The decision is grounded in clinical need and functional goals, not a number on a birth certificate. Success rates and long-term considerations. The page emphasizes that joint replacement is highly successful and often life-changing for younger patients. The main consideration is longevity. Implants typically last 15 to 25 years. So a future revision is possible. But for many, the trade-off is worth it. Decades of pain-free movement now outweigh the possibility of another surgery later. Prevention and joint protection. The article also offers practical steps to reduce the likelihood of needing joint replacement in the future. Eating a calcium-rich, nutrient-dense diet, maintaining a healthy weight to reduce joint stress, quitting smoking, which increases arthritis risk, choosing lower impact exercises like swimming, cycling, or brisk walking. These recommendations reflect a holistic view of joint health across the lifespan. What the headline ultimately communicates. The headline details a powerful message. Joint replacement is no longer an age restricted intervention. It's a quality of life decision. Whether someone is 45 or 85, the real questions are: how much pain is limiting your life? Have conservative treatments failed? Are you healthy enough for surgery and rehab? Last page, guys, coming up. Will a new joint help you return to the activities that define who you are? In other words, the stride in the headline is both literal and metaphorical. It's about walking without pain, but also about stepping into a fuller, more active life. Okay, guys, those are your shows for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.